The bad news, piling on against Obamacare, the question is, can Republicans come up with a credible replacement, something positive, okay? Here now is thinkprogress.org managing editor Igor Volsky and Manhattan Institute senior fellow Avik Roy. Avik, let me begin with you. The GOP should have something positive to say. Optimism beats pessimism. What can you tell us about this new plan developing? It's coming out of the House of Representatives. What can you tell us about it?
Yeah, so the plan is fairly similar to a plan that George W. Bush proposed in 2007. What it would do is it would equalize the tax treatment for employer-sponsored coverage and individually purchased coverage. Economists, left and right, have both said that the biggest inefficiency in our health care system is that people are dependent on their employers or the government to provide them with their health coverage.
So if I want to self-insure, this new GOP plan would give me the tax break, right, whether it's a deduction or a tax credit, and allow me to shop around. Is that the basic idea?
That's exactly.
Not Obamacare and not boards and not
whatever
central
plan
planning.
You want. It's not prescribed by the government. It's
and
not
I could
regulated.
go across state lines.
You could go across state lines with the RC plan.
Right. Igor, that sounds like, first of all, better tax treatment, and second of all, more competition. Now, a guy like yourself, who is a distinguished capitalist, ought to like this, what the Republicans are coming out with.
Well, Larry, it's one thing to go shopping for health care on your own if you're a healthy person and you have really no problem, no pre-existing condition. You can find pretty affordable coverage, and in fact, buying coverage across state lines may work for you. But if you're someone who has a pre-existing condition who is now going to be possibly dropped by your employer because the deduction changes, you're out of luck. And that's really the problem with this plan, is that there's no real solution for people who need care, who have pre-existing conditions. They use something called high-risk pools, which actually Obamacare tried briefly as a pilot program, as a bridge, and it really didn't work very well because a lot of sick people are very expensive to insure. So, you know, as Avik says, this is an old plan, something Bush tried. Parts of it are from McCain's campaign proposal in 2008, and there really isn't anything in terms of coverage expansion or lowering the trend of cost care, which is key.
Yeah. We respond to that pre-existing illness.
So Igor is thinking about it exactly backwards. The reason why we have a pre-existing conditions problem in this country is because of employer-sponsored coverage. People get pre-existing coverages when they're uninsured, or pre-existing condition when they're uninsured is the problem. How does that happen? You lose your job, or you switch jobs, and you have a gap in your coverage because you're not insured while you're between jobs.
Is that COBRA? Is that the COBRA?
It can be. Well, if you COBRA, you're okay. But if you lose COBRA, then you're uninsured. You have the pre-existing condition. Then you can't get insurance again. That's what causes the problem. So if you allow people to buy insurance for themselves from the beginning, then there are no pre-existing condition problems. Because the whole reason you have pre-existing conditions is because you weren't insured in the first place. So the key is to give people that opportunity. And maybe you need a transitional period through high-risk pools and other things to move to that system. Once you have that system, you're good to go.
See, Igor, I got to tell you, I am not the expert that you guys are in this, but I think this idea of self-insurance, which really gives you market forces, competition, patient power, is so badly missing in Obamacare and is so important in this Republican proposal. Self-insurance, and let the individual and the family get the tax break. So they run it, the government doesn't run it.
Well, the government isn't running the new exchanges either. These are going to be 50 state-based marketplaces of private insurers competing for your business.
But they tell them what's in the plan.
They tell them what's in the...
I don't mean to interrupt. They tell them what's in the insurance plan. You know that, Igor.
Larry,
they dictate the one-size-fits-all insurance plan.
Yes, because insurers have a history of cherry-picking people who are healthy and designing their plans in such a way so that they only attract healthy people. So if an insurance plan doesn't cover things like chemotherapy and the person has cancer, he's not going to pick that plan. That's the way insurers are designed, to make sure they only get the profitable people who pay the premiums and don't use the health care. That's how insurers make money. We've had that for decades, Larry. It hasn't worked.
It's not about profit for the insurers. It's about lower rates for the people who need the insurance plan. So if you're healthy, you don't want to pay a super expensive price for health insurance because you're healthy. If I'm a 25-year-old person who's never been sick, why should I have to spend $3,000 on health insurance I'll never use?
You haven't been sick until you become sick. And then when you become sick and you're in a coverage that doesn't provide you with benefits,
that's what catastrophic coverage is for.
Let him finish.
That is what catastrophic coverage is for. So a 25-year-old who's healthy can buy catastrophic coverage for a couple $100 a year that protects them against hitting by a bus, gets hit, protects them against a stroke or any other catastrophic medical illness, and yet they will be protected. So that's what you do in Singapore. So in Singapore, you have universal catastrophic coverage. You have health savings accounts for every single person there. They spend 1/7 of what we spend on health care.
See, Igor, again, I just want to note, to me, all right, I'm an amateur at this. I try to follow it a little bit. There's competition and market forces and individualism that is simply missing from the Obamacare plan. I'll give you the last word. We've got 25 seconds.
Well, I think that the competition is in the exchanges. That's where people are going to start shopping October 1st, and they're going to have comprehensive coverage that's going to be there when they need it. That's the key here. The skimpy coverage works, but only until you get sick. Then it doesn't work.
If you can shop across state lines, real quick, if you can shop across state lines, why is it skimpy coverage? You can, if I can buy something good in Georgia, I'll buy it in Georgia. I can have anything I want.
Well, there's a professor at the University of Minnesota who says that'll expand coverage by 9 million.
Igor Volsky, Avik Roy, thanks. That's it for tonight's show.